All right. So, good morning, everyone. Welcome to the ScaleHealthTech Tech Talk April edition. My name is Vishnu Saxena. I'm a founder and the CEO of ScaleHealthTech. First of all, thank you so much for joining. Early Wednesday morning. It's exciting to be here with all of you. So we have three very exciting, very distinguished health tech leaders today to talk about, on a very essential topic, which is on everybody's radar these days. And these three health tech leaders are joining from three different geographic locations and from three very different health systems. So I'm very honored to introduce, first of all, Dr. Zafar Chaudry. He's a SVP, Chief Digital Officer, Chief Information Officer, and Chief AI Officer. So at nation's most premier, children's hospital at Seattle Children. Accomplished leader, comes from being with the Seattle Children for over 7 years now. Have been worked with the past in the NHS, with the Gartner, and also very honored to have Dr. Zafar Chaudry with you here. Then going to the next speaker, very excited to join with Dr. Feby Abraham. He's an Executive Vice President, Chief Strategy, Innovation, and Investment Officer at Memorial Hermann Health System in Houston, Texas. A former McKinsey partner, and he leads, I would say, one of the nation's best hospital-led, health system-led venture fund, which is in the tune of like 500 million US dollar. And going to the next speaker is none other than Matthew Fenty. He's a Managing Director of Innovation and Strategic Partnership at St. Luke's University Health System in Allentown, Pennsylvania. That I cherishly recall. I used to live in New Jersey for 13 years and, been there. So all these three leaders I've been, known many years, and very excited to have Dr. Zafar, Dr. Feby, and Matthew Fenty here to talk about an essential topic of enabling cost-effective and sustainable digital transformation in the new health economy. So, we have a 4 segment to cover, and that's how we are going to talk about it and understand, why it matters, what are the challenges hosting, how we strike a balance, and of course, how and why the collaboration can help us to do that sustainable and cost-effective digital transformation. So with that, I think if it is okay, Dr. Zafar, Dr. Chaudry, Matthew, and Dr. Feby, if we can start.
Yeah, good morning.
Hey, good morning, everyone.
Good morning. Good morning. Very excited to have you all. And so before we start, if you want to say something at the outset, Dr. Chaudry, Dr. Feby, and Matthew, please feel free. I just did a high-level introduction, but audience, I'm sure they would love to know more about you and your health system.
So thank you for the introduction. Thanks for having me on your show. Seattle Children's, yes, we're a pediatric health system. 47 sites across Washington, Alaska, Montana, and Idaho. So geographically, we cover the most area of any pediatric system in the world. And our mission is hope, care, and cure so that children can live their most fulfilling lives. So pleasure to be here with you.
Our pleasure, Dr. Chaudry. Thank you so much. Feby?
Good to be with everyone. Good morning. I'm Feby Abraham, as you mentioned, Vishnu. I'm the Chief Strategy and Innovations Officer here at Memorial Hermann. Memorial Hermann focuses on the greater Houston and Southeast Texas corridor. We are a network of about 17 hospitals, just under 300 care locations, more than 6,500 physicians in our network, in a pluralistic setup of academic, employed, and independent affiliated docs. Business is organized into 10 service lines. So we cover all whole body and such as adult, women's, and pediatrics, but then also a lot of specialty service lines such as cardiology, oncology, etc. And we have an integrated delivery network. So we have our own health plan and at scale ACO and MSSP product. Look forward to the dialogue today on digital transformation, how we can help accelerate that within health systems.
Thank you, Feby. Appreciate it. And a hidden fact, Dr. Chaudry and Matt, you don't know about Feby. He's a rocket scientist. He went from a mathematics background into consulting and advisory, and now with the health system. So great background. Matt?
Hi, good morning, everyone. St. Luke's University Health Network is located about an hour north of Philadelphia in the Lehigh Valley area of northeastern Pennsylvania. 13 or so hospitals, more than 300 physical ambulatory locations across the greater Lehigh Valley and western New Jersey markets. St. Luke's has been around for more than 150 years, serving the community of Bethlehem, Allentown, and the greater Lehigh Valley area. Very interested, in having this conversation today on technology and change across large enterprise organizations.
Excellent. Thanks for that quick round of introduction. So let me get started with our first segment, which is the importance of sustainable and cost-effective digital transformation in health system. So, Dr. Chaudry, let me start the segment with you. You are a accomplished leader in a great health system. You're a CIO, you're a CDO, you're a chief AI officer, and you have led variety of transformation, like business, people, IT, clinical, you name it, you have done it. And I saw your annual IT report, and I would encourage our audience to have a look, and that's an eye opener. Kind of the digital transformation that you're leading, that's mind blowing. So, what's your perspective, Dr. Chaudry, in terms of why we should be talking about sustainability of digital transformation in health system?
Yeah, so thank you. I think first thing is most organizations define digital in many different ways. I mean, truth be told, I don't know what the definition of digital is anymore because it's been pretty much used to death. And the whole, we are going to digitally transform. Well, I think we've been trying to digitally transform forever and ever, and which is very slow at it. But if you look at the core reasons for the importance of sustainable digital transformation, well, most importantly in today's world is financial stability, right? So digital tools, they can help you optimize your resources and lower costs in a very strained economy. And currently, healthcare is facing some huge headwinds as we move forwards. The other thing is around better patient outcomes, right? So digital solutions, they can help care quality and access for the longer term. Thirdly, we look at workforce and supporting the workforce because we know that technology can ease staff burdens, promote a sustainable workforce, help with retention, help with recruitment. Then you sort of have adaptability. So I think the digital systems that you put in, they can enhance resilience and evolve to the needs of your particular health system. And every health system will have slightly different needs based on the population that they serve. Then you've got continuous improvement, right? At the end of the day, these tools help us use data because data-driven insights, they fuel ongoing innovation and efficiency. And analytics is part of that. Automation, you get through digital transformation. And then some of the tools where you can expand care beyond your borders. So this whole concept of remote care, hospital at home, how you can be more preventative and keep, in our case, keep kids out of the hospital. And of course, coordinating care isn't the easiest thing to do between multiple providers. Certainly in the pediatric space, we get primary care and then secondary care and then tertiary care and then social care. So these tools, this transformation you provide to your teams allows you to improve that coordination. And I suppose most importantly, the engagement of patients, right? At the end of the day, the new generation, certainly of kids, the new generation of kids are digital natives, right? I mean, I cannot use a smartphone as quickly as I see a kid use a smartphone. I'm just very antiquated, but they use those tools natively. Now, there are some sort of barriers to whole of transformation in the digital space. I would be amiss if I didn't say that there is some still resistance to tools that you put out. You've got to train people up on these tools. It's not a matter of, not everybody's a Gen Z. I need training for most of the tools we create. And, let's not forget about the big thing, data security and privacy in any
Yes.
transformation work that you do using digital tools. So those are some of the things I think about.
Excellent. Excellent. Thank you, Dr. Chaudry. Feby, and to our audience, you're in a unique role. You're a chief strategy officer, you lead innovation, you're a chief innovation officer, and you're a chief investment officer. So, you get to see, a health system from all three different angles. I mean, and I'm sure there are many, but, three as a core part of your responsibility. And over the period of years, as you have seen, what's your perspective in terms of why digital transformation has to be sustainable in this new health economy that we live in? What's your perspective, Dr. Feby?
It's an imperative in my view, and I think very similar to Zafar's comments. Let me just sort of unpack the way I see it. One, let's talk about the cost of healthcare. We're spending close to $5 trillion on its own. US healthcare spend is touching the GDP of Germany, so it'll be the third largest GDP on its own. Spending 20% of our GDP on healthcare. And if you divide about 4.5 to 5 trillion divided by 330 million humans, you get to about $13,000 to $14,000 per human per year. That's unsustainable given the debt cliff and all the things that we're talking about. Just as an example, our balance of trade deficit, on which the tariff war has so centered the news over the last 3 months, is only 750 billion compared to 4.5 trillion of spending. So I think we need to sort of think about digital, and at the same time, we don't get more out of it. So if you stack our outcomes relative to the other OECD nations, the industrialized nations, we rank dead last in terms of outcomes. Whether it's total mortality, infant mortality, maternal mortality, take all of your KPIs. So we spend more and we, at least on a headline basis, don't get as much. So how are we using technology, number one, to sort of really improve outcomes and reshaping that cost curve and saying, how do we sort of reduce that overall burden? And let me just give you some areas of opportunity, right? 25% of overall expenditure is spent on is related to some sort of administrative burden on providers and payers, etc. Site of care optimization. You don't need to send the wrong patient to the wrong site of care at the wrong time and explode care. You're not managing the disease burden of the patients. And all of those things, technology can be an excellent accelerant. And I think we need to sort of recognize that. That's number one. The second is the shortage of workforce and the challenge that is going on from a workforce standpoint. The supply-demand arbitrage, if you look at the headline numbers and nurses, about 300,000 shortage of nurses, more than 100,000 in terms of physicians. And that leads to, as Zafar was saying, access challenges, right? And so how are you going to sort of reshape the access equation by dramatically improving productivity? Healthcare is one of only 3 sectors outside of government and education where productivity has declined in the last 60 years, whereas manufacturing, the productivity has grown 10x. So you're thinking about how do you sort of leverage a completely altered productive workforce, leveraging technology, and that's where technology can be a big accelerant. So I think that's the other piece of the pie where I think technology can be helpful. The third, as Zafar was saying, is also around consumer experience. Patients will demand a unique type of experience in the way they shop for their banks and their travel, and we need to sort of provide them exactly that in the context of healthcare. And finally, we shouldn't sort of ignore the efficiency burden, right? And especially health systems are at the vanguard of it because we get squeezed on both sides. We see all the inflation in supply and labor, and get squeezed by the reimbursement pressures that our insurance companies put on us. So how are we dramatically in re-engineering workflows using technology to sort of shape that cost curve and dramatically improve efficiency and therefore drive sustainability is a key lever to sort of consider. And Vishnu, to your point, the way we've approached it is we've created a partnerships umbrella so that when there is technology concepts that are proven, we can do a joint venture partnership with that concept to really expand how we provide, how care is experienced, accessed, or delivered through those vehicles. And the second thing is when something is an emerging technology that's not been well validated, we can do something in a pilot, then scale it up through our innovation hub. So trial it at one hospital, a handful of clinics. If it works, we could scale it. And that, again, the thesis is of sustainability. We want to make innovation in bets. We don't want to boil the ocean. But we want to really trial innovation at a fast pace and do that in a contained setup, in a financially prudent approach, prove that it can actually work to establish its financial and non-financial KPIs before we scale it across the platform. And the third is, as you said, we have an investment fund to sort of support growth companies that are creating great technologies to support either digital innovations on its own as digital natives would, or they have tech-enabled services that expand care outside the four walls of the hospital with technology as an enabler. In both of those things, we want to sort of shepherd those companies and make sure they're long-term successful. So that's the approach we've taken.
Terrific. Can't be more agree on that. When it comes to all the levers, all the key, the quintuple aim of the healthcare. And if you see from that point of view, the digital transformation actually has to result into a better outcome altogether. And all these three levers are actually geared towards achieving those goals and reducing the cost of care. So I think that's great. Thank you, Feby. Matt, so you lead, you're the director of partnership. You lead innovation in Northeast, one of the most reputed health system in Pennsylvania now, also going into New Jersey. How do you see, the digital transformation should be sustainable, or in the new health economy? And as you do innovation, as you do transformation, what's your perspective on that sustainability goal for the health system?
Yeah, I think the underlying trend is, change is inevitable, and it's required for our industry. From the pressures that Feby and Zafar had mentioned, we as a sector need to think about how do we, think about cost pressures, labor pressures, reimbursement pressures, then also make sure that we don't, take our eyes off of patient care and executing the mission in which we're in. And so with other organizations, other kind of companies, you might be able to stop operations, retool your business, and then kind of go forward. With healthcare delivery, you can't just stop. So you have to think about how do you do things in parallel, put in new technologies, new types of care delivery models, new types of initiatives, tech-enabled type of services, care in the home, but then also making sure that you're not kind of leaving behind, your existing kind of clinical practice or the kind of core operations. So that type of sustainable transformation has to be very mindful as you're working with your colleagues, your clinicians, your frontline staff, your nurses, your ancillary clinical support, who has to deal and manage these types of transformations. And so from their perspective, it's how do they do their day job, and also think about how do they do the role of healthcare delivery, in 5 years from now. And that's going to be potentially radically different kind of care delivery model. So from how we think about transformation and sustainable transformation, it's having that buy-in and thought process on day one with your end users, with your clinicians, your nurses, whomever, so that these types of initiatives can be durable long-term. We don't think about pilots in terms of technology. I've been at St. Luke's for about 10 years. I think about phase 1 deployments, because from either a technical debt or kind of the implementation lift to get small projects off the ground, we need to think about what is that long-term enterprise scale potential on day one, and the amount of operational impact and change and disruption is likely going to be significant. So if we can build that kind of in and front load that type of transformational thought process in the beginning, then we can get all of our stakeholders knowing that change is coming. We can think about the economic model the sustainable economic value of these initiatives, tie that with the clinical benefits or workforce benefits, and then think about what is that long-term scale. And so as an organization our size, we typically will start with one department, one hospital, one service line, but we know before we even sign a contract with any sort of change, this is going to be across the board an enterprise standard. So these durable and sustainable transformations, you need to really be thinking about that on day one. What is that total scope across the organization? And each company's, each organization is different in terms of their culture, their size, their technical sophistication, the employee kind of engagement. But as healthcare organizations, we've been pushing technology change and all of these different initiatives pretty hard in the last 5 to 10 years. So in order to have that continued transformation within your organization, having that perspective of what we've been pushing in the last 5 or 10 years has to be top of mind in order to get that and maintain that sustainable change within that company.
Yeah, no, I think that's so true. And I think in your opinion and your perspective, Matt, I think you talked about the change management and alignment of your digital transformation goal with the enterprise strategy, and making sure that there's a buy-in across the board, so that whatever the change that you do, it reflects and across the enterprise. I think that's a great insights. Thank you. I think moving to the next segment, which is let's get a little bit into the weeds in terms of what are the challenges. Feby, you talked about as you articulated in terms of like unsustainable nature of the healthcare that we are into, like 20% of the US GDP, the healthcare, which is totally unsustainable, and we have been talking for very long. And now when you see a health system, the whole idea of digital transformation is trying to make sure that we achieve those quintuple aim of healthcare, and provide that better outcome, reduce the cost of the care, equity, and of course better outcome. Now everybody's trying, every health system is trying, and again, I go back to your unique role in terms of like strategy, innovation, investment. So in your experience, what do you see the challenges that holding health system back on the digital transformation highway? So everybody is trying, and of course, Zafar will bring the perspective from the CI and the CDO perspective, and like he just released a report, and I was reading that. That was amazing report that talks about the kind of the transformation Dr. Chaudry is leading in Seattle Children's. Now, so how do you see in terms of what the challenges are? Like, is it like manpower? Is it like technology, strategy is not aligned? I mean, DD is not aligned with the enterprise business strategy. The resources are not there, or all of the above?
Yeah, I think it's some of the concepts we touched on, but I think if I just go through it, number one, it is connecting whatever we're trying to do from a digital transformation lens with the priorities of the strategy first. And there is a lot of digital innovation out there.
Right.
We all get caught in shiny object syndrome. But the more we can sort of articulate what is the true problem we're solving, what is the driver of value creation that results from it, then we are less likely to be a hammer in search of a nail when it comes to a digital concept. We're more likely to be saying, hey, we're truly focused on this, solving this problem. This is how it connects to the strategy, and sets up a prioritization roadmap. So that's item number one. The item number two is there has been sort of we need to be articulate as technology leaders on where supply side maturity is there and where it is not there, and what is it that we have a right to win to develop on our own, and what is it that we have a right to win to sort of work with partners on. So really articulating
Right.
that is important, because I've seen a lot of failed efforts where people are trying to do things themselves, but maybe they don't have the right to win on their own, and that becomes a failed experiment. Maybe they should sort of look towards a partner which has access to better talent, better capabilities, and functionality to sort of deliver on it at a multi-market scale, and therefore enable faster transformation. I think it's good to sort of articulate those drivers around where do you have a right to win, where you have and therefore you should build, versus where you need to sort of partner. The third thing I always think about is, and Matt touched on it, which is we very much think like that, right? Which is that anything that you're trying to do, you have to have a roadmap for scale. What does great look like? How are you doing it? I love the word pilots, but it should be in the context of design of experiments, which is a statistical tool which says, hey, we're going to try a bunch of parameters and how this works. Some things won't work, some things will not work, and some things will work. And we're going to fine tune the results in a way that gets us to scale. Having that articulation and vision of what scale looks like and what the barriers to scale would be, to sort of think about both the bear case and the bull case would be important. So, and most often, one of the things that we need to understand is technology did exist, perhaps not at this level of sophistication as today. The generative is brought in through the AI context, but even before technology did exist, it was a lot about adoption. How do you get the clinicians and the nurses to adopt, and even your back office staff to adopt certain technologies at scale? Truly understanding what the barriers to scalability can be and how you're solving that up front would be really helpful. And finally, I like to think of flywheels. As they say, success is many mothers and failures are often orphans. I think it is helpful to sort of start to say, how are you sort of defining the change story with a handful of great catalyzing events, which are showing the organization how transformation is happening? So many organizations have attempted great results with ambient listening. We've done the same. How do you sort of
Right.
reduce nurse churn? How are you trying to bring predictive analytics solutions to bring clinical decision supports and therefore improve your quality and outcomes? How are you enabling hospital at home and transferring the right patient to the right side of care across
Right.
virtual, retail, care at home models and inpatient home models? I think showing some of these transformation levers and how each part of the organization is going to be helpful is important. And finally, I mean, I said final, but there's one thesis that sets all of this. I think we all need to, as technology leaders, think about the financial case more intently and sort of start to sort of frame up front, what does the ROI look like? I think the CIO and CDO role should pivot away from purely being a technology executor to being a strategic finance partner to think about technology and the ways in which it can be linked to value creation.
Super, super. And as you said, Feby, I mean, of course, the technology was there. Technology will continue to be there, and it is not a shortage. And there's so much of innovation going on, adoption, and I think from the real user, from the clinician, nurses, and all, and getting the buy-in. I think that's very important. And I think, of course, the challenges across a variety of areas like shortages and all those will continue to be. But I think the real is like when the technology is being adopted, that's where the innovation is transformative. So thanks for sharing that in terms of like what's holding health system back on DD. Dr. Chaudry, same question to you. I mean, you're a great CIO, you're a great CDO, you're a great AI leader, and I was leading report that you have implemented a first platform across the enterprise on the AI. So what, in your experience, you think, not only in your own hospital, but when you talk to your fellow CIO friends in Chime and others, what is holding health system back? Is it like legacy systems, workforce, difficulty in recruiting talent, budget is not there, which I'm sure is in children's case is not there, or business and clinical digital collaboration? Guide us through, sir.
So it still goes back to, what problem is your health system trying to solve, right? And we still suffer from the shiny toy syndrome. So you go to a conference, you see something cool in technology, you want to acquire it, and you don't necessarily know why you wanted to acquire it, because we're very good at doing 100 things badly versus 5 things well, right? So I don't think I agree with Feby, it's not about the technology, it's about what does your health system need and what business is your health system in, right? So if you're a health IT group in a hospital or hospital system, your job is patients, not technology. Technology is just a means to an end in terms of taking care of the patient. So you do have to think about when you're investing in these sort of tools, are you aligning with the strategic goals of your organization? The patient care, the efficiency, the access, the cost. And yes, the biggest headwind right now is finances, because people are losing their funding, they're not getting their research money. Medicare, Medicaid programs are probably imminently going to be affected. And that has an impact on how you can run your health system, because the goal is to take care of patients. And yes, money is something you need to do that, but technology will be a cash burn for any organization, right? Most technology innovations today require pump priming of investment, and then over a period of time, you may see some return on that, or you may not. It might all be soft benefit. It might all be cost avoidance. I've very rarely seen a technology that brings cash back to the organization. It's not like a credit card where you get your money back, right? So
Yeah.
you've got to balance what value you bring your clinicians, and that has value, versus what you're going to do and how you're going to spend it. And remember, every couple of $100,000s you spend on technology decisions takes away from patient care. Because an IT group like mine in a hospital system is a big L in a P&L business. I don't generate revenue, but I'm good at spending money that I get on new cool toys that I might have seen. And so you've got to make sure that you're buying tools, you're partnering with vendors who have the same vision as you to align with the strategic goals of the organization. And every organization will have slightly different goals, right? We're a pediatric system. We're not for profit. We don't send you a bill if you come and you can't pay. That's not every health system strategy, right? Some health systems are for profit. Some health systems will chase you down for the bill. We don't do that. So we have to be very careful on how we spend. So I think in the conversation around what is the next best technology or cool innovation we're going to have, you have to find a balance between what can you actually put in, how can you sustain that, and then what benefit will actually bring over a period of time. And all of those things take time, right? If I put a new innovation in, AI is an interesting one, right? And this would be a conversation if we didn't talk about AI, but AI is a very, very expensive investment, and the gains will take time to deliver. So yes, there's operational efficiency in the back office, and there's some clinical benefits, but it takes time to develop these algorithmic models, right? Contrary to what vendors tell you, very few things in AI are out of the box, unless you're writing an email or something. But that's not really revolutionary. What's revolutionary is, can you use an AI to predict disease patterns? Yes, you can, but you have to feed it with a lot of data. It takes a lot of time, a lot of configuration. Still takes human smarts to train the model before you really get an output. And all of that takes time. So there's a sustainability component that people forget about. You know, if I'm bringing in innovation, am I going to be around long enough to see that innovation through? Or am I the person who bought all the shiny toys and then handed it to someone else and said, good luck? Because I've taken a promotion because I bought all these shiny toys. So I think you have to find the balance between what are you really trying to do with these technologies. So I totally agree with Feby on the whole fact that the CIO of the future isn't a technologist, right? It's got to be a business-centered, finance-oriented leader who truly understands the ins and outs and complexities of the business and how it's funded, to then decide where to invest the money, and all of that in collaboration with a multidisciplinary team of stakeholders from across your health system.
Great. Technology acquisition, balancing with a ROI. in terms of sustainability and their validity in terms of the how long and how soon it can give the outcome, and the CIO to be a finance driven, data driven leader who can envision the ROI that a technology can bring. I think that's a great point, and I think Dr. Chaudry, the point that you make in terms of a lot of technology out there, and everybody gets attracted to those, but not having a business case or clear ROI. And I think that's where they would call it that this is my digital transformation priority 1 or 2 or 3, but then it may not give the ROI. So it becomes an expensive, as you said, L in the P&L, and that does not produce the outcome. And maybe like a year from now, that does not produce an outcome, and it's unsustainable. So thank you so much for that. Matthew, so of course, you lead innovation, strategic partnership, lots of transformation over the period of years I have seen you have led. In your experience, Matt, when you were leading these initiatives, even St. Luke's or in neighboring health system, in your experience, what do you think are the key factors that holding health systems back on their digital transformation superhighway?
I think we need to make sure that we're thinking about the word transformation. Transformation is not by definition a simple one and done, overnight, turn it on and it's done type of initiative. And I think
Right.
for in the 10 years ago, 5 years ago, many organizations, health systems have turned on point solutions to solve very niche, very specific, department, individual problems. That's not transformation. That is solving, this clinician's challenge today, or that, service line administrative leaders challenge today. I think you can look out, adoptions of RPA and revenue cycle, as a very, you're addressing prior authorization, very tactical challenge. But if you think about how does the organization think about automation as a transformational capability, that is not a single leader within one department, within one vertical making that decision. You're transforming how the organization functions using technology as that enabling platform. And so when we think about technologies at this point in time, these are not conversations we have with one service line or one hospital, one kind of clinical department. We need to bring together almost everyone in the entire organization and think about how does this technology approach this pure technology, this technology plus a service, or however you want to bring that capability to the table. How might we think about adopting this across the enterprise? What are the different use cases with this technology, whether it's a specific vendor or a specific approach? How are we planning a multi-phase adoption so that we're transforming not just one department, but the entire organization where it makes sense? How does it align within the corporate strategy of either growth of service lines, growth of market share, whatever that might be? How are we enabling that strategic pillar to be executed?
Right.
Using technology as that mediated platform, and then ultimately, ensure that we have budget for it, right? And so if we're thinking about, the vendor cost, the advisory cost, we think about what are all the different ROIs or use cases that can incrementally add value to an enterprise platform. And by definition, these are not easy things to do because you're transforming fundamentally the entire organization or across multiple divisions. And so that mindset has to be on day one at this point in time, because many of the point solution problems have been solved, either solved by your core IT partners, whether it's Cerner, Epic, Microsoft, Workday, ServiceNow, what have you. A lot of those individual problems have been addressed. So now you're thinking, what are the transformational, initiatives? Do we want to do more care in the home? Virtual clinical practice, telecritical care, telehospitalist, more virtual nursing across the board. The technology part is the easy thing to check the box on. It's Do we have the clinical staff? Do we need to negotiate physician contracts? Do we need to think about regulatory? Do we need to bring in JCO or the State Department of Health? How are we thinking about these enterprise transformations? And by definition, this is not an easy thing to do or a quick one and done. So I would say it's not holding back, but you need to be very mindful on day one that this is, an initiative, whatever it might be, that is going to be a very complex book of work to do.
Great. Yeah. And I think, Matt, to your point, as you said, it's not about the holding back, but in terms of how you want to approach and get out of that situation in terms of whether it's a one initiative or multiple initiative on that digital transformation priorities, bringing entire like a stakeholder together and get everybody buying. I think that's where I think you have been your focus is in terms of like get that the right stakeholder behind one of the key initiative that you want, and then take it forward and make sure that it does produce an ROI.
And I think maybe us as technology leaders, we probably know where these technologies or these services can deliver value to the organization.
Right.
It might take 3 or 5 years from now. And so we know that kind of in our hearts. We just need to bring our clinical colleagues or our frontline colleagues or administrative colleagues to the table with us and tell the story of where we think within our organization we need to transform to kind of see the future where it could be.
And I think I'll just double click on it real quick, Matt and Dr. Chaudry and Feby. Otherwise, to Matt's point, it will be in silo. If not clinician and operation, if not everybody's on board, then I think it's living in silo, or maybe the shadow IT is getting mushroomed.
Yeah. So you don't.
Go ahead, Dr. Chaudry.
Yeah. So my job isn't to tell the organization what technology they need, right? My job is to facilitate the conversation between the multiple stakeholders to determine what they think they need. And then I'm supposed to interpret what they say they need into something that's usable and workable from a technology perspective. So our approach here at Children's is very much, since we're a kids-based organization, to involve the kids and the parents and the caregivers in developing our digital plans and strategies. And we meet with them. We have a group we meet with every month to talk about what do they need us to do from that patient perspective. And we actively engage the clinicians and ask them the same thing. So I always tell people I profess to know nothing about anything. I just go out and ask people what they need and then translate that into something that is possible. And sometimes it's not, right? So you've got to figure out whether everything, it's unlike what any vendor will tell you that everything is amazingly possible. There are some things that won't get you to where you need to be. But the first job is to listen. Once you listen, you then translate and then bring tools that people will use. Because remember, we've talked about this today about people don't like change. Who likes it? I don't even like change. So when you give me new things to do, new things to learn, in an environment where everybody's overworked, tired, burnt out, that causes problems. Change is really hard to implement. So by involving the people first and asking them what they need and then helping them solve the daily problems that they have, you have a higher likelihood that there will be a level of adoption. And without that adoption, what was the whole point of making that investment, right? And as Feby said, the US healthcare system spends more on technology than anybody else and has the worst outcomes than anybody else. So it doesn't mean that you have to be the leading in the technology arena to actually take care of a patient, right? Contrary to belief, people go to medical school like myself, and they teach you on how to take care of a patient. They don't teach you to be the Google Doc.
Oh, yeah, so true. Yeah.
So that's what you got to keep in mind.
So a great perspective, Dr. Chaudhry. Excellent, excellent. We got 15 minutes now, and we'll try to squeeze 2 segments. Now, I think this is the third segment that we're going to talk about some word of wisdom in terms of like what are the best practices, how we strike a balance between the healthcare outcome and the sustainability goal. So, the whole idea of putting investment in digital transformation is to achieve a better outcome for patient and for the business. And in order to achieve those outcomes, then we think about, okay, so let's do some digital transformation initiative that can help us achieve those outcomes. Now, and then there are lots of investment going into those digital transformation. So Dr. Chaudhry, I think let me start this with you again. I think you can continue. How do you see a health system should be able to make a balance between the health outcome that they want to achieve and the financial viability? Because in order to achieve those fun outcome, they got to do a lot of investment. So how to strike that balance? Some word of wisdom from you, Dr. Chaudhry?
Well, I mean, that still goes back to Feby's comment about the evolving role of the CIO, Chief Digital Officer, whatever your title is now, the person
Great.
who leads the technology group, let's say, because there's so many different interesting titles. The job of that individual is to first understand how their health system is funded and financed. You then have to coordinate with your finance team. Your CFO should be a
Right.
good, strong partner of yours. You need to partner with the strategy officer because you need to know what direction over the next 12, 18, 24 months the hospital is taking, and then work with stakeholders, right? So once you've assimilated that information, that is when you can decide where is the best place to invest in technology. How much juice can you squeeze out of the lemon? And
Yeah.
remember that most technologies we buy and implement in healthcare, we don't really use. The average software we have, we use only 20% of its functionality, including the EMR, which is our
Yeah.
key core function, or the ERP. So sometimes the answer isn't you must buy more technology. Sometimes the answer is, are we really utilizing the investments that we have already made? And should we revisit those investments because we've forgotten about them, right? I mean, a hospital doesn't run without an ERP and an EMR. And yet we forget about that. And what we try to do is buy more tools to bolt into that system. So at Children's, we've taken the approach of look at our portfolio first before we invest more cash in cool solutions. Because many a time you don't know that the tools you have functionality that can solve for what you're trying to solve for. I mean, let's take a look at the EMR. Many people don't realize that EMRs now are bringing AI functionality as part of the stack. So why would you go out and build one when you could use the existing stack to scale solutions without a lot of investment? Sometimes the licensing is already there, it's included, it's an added feature, right? It's no different than buying a car, right? I mean, you have a nice car and it has heated seats. So what do? Go to the showroom and then buy another nice car with heated seats. Well, you already had those, right? So why should you go and then buy the exact same thing when you already have the same thing? So that's the same thing with software in healthcare. I think you've got to look at your current portfolio of investments, because we have application sprawl. At Children's we have
Yeah.
1,163 applications, clinical and non-clinical, and the question is, wow, and why would you want to use all those applications? Are we really using them to the best of their capability and ability? And the other value add you have with partners you already have is that they are adding functionality at no cost into the software platforms you bought. You just need to keep up with what they're actually doing. And people don't do that. People actually just go to a new vendor, not realizing that their existing vendor may already have that functionality. So I think if you're truly going to be a financial steward for the organization that you're working in, we've got to start looking within and not so much looking outwards. And I'm not averse to bringing in new technology, but I really do tell my people that app rationalization and using the tools we have is a better strategy in a difficult financial climate than going out and buying something brand new and starting from scratch.
So true, so true. Maximize your internal investment, leverage that, and making sure that we generate the ROI and before looking out. So true to strike a balance between the outcome that we want to achieve and the financial viability and sustainability. Feby, coming to you, of course, you run, I call it like one of the best health system-led venture fund, and you have invested over 50 plus companies. So you get to see and you get to invest into a variety of companies, and all geared towards achieving a better healthcare outcome, not only for Memorial, but for many other health systems who are gonna leverage those technologies that you're investing into. So how do you see, how you prioritize, and how do you see a equilibrium is needed, or what are the best approach where you can strike a balance between the outcome that you want to achieve in an immediate and long-term manner versus the financial viability in the funds?
Yeah, no, I think, for the financial viability, as I was mentioning earlier, and as Zafar said, like connecting it to the strategy and so on, I think describing the drivers of value creation and connecting the enterprise strategic priorities with the financial objectives is very important. And there are a few drivers of value creation, right? Like, number one, the one that is most easy to understand is efficiency, right? There, I could sort of bank it, right? Like there is either some sort of lower cost to serve, either in terms of human or non-human time to do a service, leveraging technology. That part is the easy one to sort of bank on. The second one, which is harder to bank on, but is very critical, is to sort of say, how do you become a more attractive platform for consumers? And that means that because you offer a technology, you could created a level of convenience and you are making an easy button for them, you're able to sort of improve your input funnel in terms of consumers select you versus others. And that one is harder to fully underwrite, partly because there are multiple initiatives on brand marketing, your clinical programs. But I think we should sort of bring technology as front and center into that dialogue, into sort of doing that. The third is workforce satisfaction that leads to higher levels of retention and better ability to attract workforce, which in this day and age is an important condition because it's a supply short industry in workforce and labor, and we need to sort of really be on top of that trend. So if you're implementing a new robotics approach or an automated approach, which then brings a newer level of clinician and nurses to sort of leverage your platform, and their burnout levels are lower, and they have the joy of practicing medicine once again, and therefore they stick within your platform longer, that becomes an important one. So connecting the value creation driver to that is important. To your question on outcomes, when I think about clinical outcomes, it's important to connect a lot of those benefits to also your reimbursement mechanism so that the incentives are aligned within your provider network and within the health system as well as with your insurance company. So, for example, if you're investing in remote patient monitoring and your visits are only going to be measured through hospital stays, how are you actually creating value? You're doing the right thing for the patient, but how are you incentivizing everyone to sort of invest appropriately to take care of that? So I think thinking about the solution set upfront and thinking about how you're connecting this with from a technology leadership standpoint with the strategy and finance leadership to figure out how you're going into value-based contracts or having outcomes-based incentives aligned so your technology can not be penny wise and pound foolish, but you're really investing in those critical enablers to generate the outcomes, and measuring all of that is important. And finally, as the first said, there is a cost avoidance on the infrastructure side where you say, hey, look, by doing this, it's the cost of doing business, but I'm leveraging a technology which avoids a lot of costs that we can connect to capital and operating expenses over time. I think it's good to be articulate about all of these things and then lay out a bunch of priorities. We then have to create a almost like two axes to say one is the level of impact across those financial metrics, and the second is the immediacy of impact. Like, are we, and then create a portfolio of bets. Some of them will have high investment, high impact. Some of them will have unclear ROI in the near, but so long as you're taking a portfolio theory that, hey, we need to make some bets because we know the connection to the value creation lever, but let's make those bets now and see how they play out over time. That'll then help you create a portfolio that grounds itself in true value creation. So I think that's the approach we've taken in terms of what are the things that we want to go bold or go home kind of philosophy, and what are the areas that we want to run through a phased approach of pilots to scaling.
Excellent, excellent. Efficiency, incentive alignment, cost avoidance. That's the great ideas. Matt, I'm loving this. I'm really enjoying the insights. We got 2 minutes, so Matt, maybe you can share in terms of what's your thoughts in striking the balance, and then I will have one word of wisdom from each one of you on the collaboration, and then we'll wrap up.
Yeah, I think to be sure, I know we're approaching the time, but I think Feby said it right so far as well. It's aligning technology and change to the organization priorities. You have to think about how are these initiatives economically sustainable, ideally on day one, so that when you start to roll these things out, they can start to add value, but at least somehow pay for itself. Because you're up against every other capital budgeting process within the organization. So you have to have alignment from your CFO. You have to think about the change to your operations, so your chief operating officer, or whoever is overseeing in the frontline workforce. You have to align with your clinical workforce, your clinical leadership, and so having those stakeholders on the same page with you as the technology leader, the digital transformation kind of sponsor on this initiative. It's really you're enabling strategy, you're enabling a strategic execution, and those leaders need to be fully on page with you. These are not IT-led initiatives. It's not the CIO leading these things. It's operations in conjunction with the technology function. So those organizations have to be in line, and you're executing strategy with technology.
Superb. No, I think we are at the top of the hour. If there's any final word of wisdom on the collaboration, how we can leverage the collaboration to drive those sustainability on the digital transformation, Dr. Zafar, and we all are doing lots of collaboration. Matt, you, Dr. Feby, you, and Dr. Chaudry, you. Any 30-second or less word of wisdom, Dr. Zafar?
No, I think the discussion today is very much around involve the right people at the right place at the right time, and then design to solve for a particular problem versus just buying something shiny.
Awesome. Super. Matt, you do lots of collaboration. You are the managing director of partnership and innovations. What's your word of wisdom on collaboration?
I would say be very mindful of who you start working with. Odds are it's going to be a very long partnership. Technology companies, many of them are still very kind of early in their own maturity, so you have to be very mindful of who you're working with, and as the technology likely expands across your organization, that you have a good professional relationship with these organizations, not just from using them from a technology partner perspective.
Super. Feby, last word.
Yeah, I think it'd be good to articulate the why, what, how of partnerships. The why, to me, is understand your right to win in the market. For a lot of us health systems, it's about being great clinical brands. We don't have the technology infrastructure to compete with the Apples and the Googles and everybody built in even the talent pool that goes with it. So let's fully understand the reason you're partnering as opposed to trying to do that. That's the why. The what is, as Matt was saying, define the principles of partnership. It's a long journey. Just define the parameters of how you set up the partnership in the first place, and the how is make sure you're putting people and capital investments appropriately, not just at the front end, but also through the cycle to ensure that the drivers of value creation are being realized.
Awesome. Excellent. So if I may ask you to stay for you can continue to do whatever you're doing just so that the StreamYard can record and upload that. So if you can, after we disconnect, so you can just be there for a minute or so. I think that will help StreamYard upload that. So with that, I think we conclude the ScaleHealthTech Tech Talk April edition on enabling cost-effective and sustainable digital innovation in a new health economy. So thank you so much for joining. The recording would be available. And I really want to, appreciate and thank from the bottom of my heart to Dr. Zafar Chaudry, Dr. Feby Abraham, and Matthew Fenty for joining this Tech Talk, and a really insightful discussion on, and I would say, what are the secret sauce and the recipe for cost-effective and sustainable digital transformation in new health economy. So thank you so much, everyone. Look forward to our next episode. So signing off. Have a great day. Thank you, Dr. Chaudry. Thank you, Dr. Feby.
Thank you.
And thank you, Matt. Take care.
Thanks.